Well, I'm pleased to address a group in India who's beginning a struggle for better health care and addressing some of the issues we commonly face. The ones we confront in the United States today is the progressive industrialization of medicine. That means commodification of everything about it and proletarianization of the health workers. That includes doctors, nurses, and everybody. And the results have been making the hospital the center of health management. The EW is where most patients go. The cost of healthcare in the United States, which reflects this transformation, has risen from about $150 in my heyday in the 50s to nearly currently about $10,000 per person who lives in the state of Massachusetts. There has been also calamity in that the doctor is distanced from the patient, and that distancing is transactional as the transaction becomes removed from that of commitment to humanitarian goals and well-being of another human being. It becomes a business, and that business is undermining the profession today here, as I'm sure it's doing everywhere, nearly worldwide in my experience. So that safe systems like the British are now being undermined, and the other nations cannot protect themselves against this mayhem that is confronting us all. This is another way to introduce a new organization to the issues that you face, but I'm sure you're conscience-driven. There is, of course, a difficult problem that confronts medical students today, because as they enter medical school, they're full of idealism in the first year. They are in the United States. Many of them go to developing countries, to Africa, Latin America, spend time working clinics, and once they reach their third year of medical school, there has been a profound transformation. Instead of doing good, they want to do well for themselves. Now, when one asks why this has happened and how this has happened, it relates to their entering the hospital. They confront the system of medicine as it operates today, with the patient incidental to the whole operation that they see, where instead of a humanitarian venture, it is really a business venture in many ways. The visit with patients is hurried. Most of the transaction go in a conference room, and one of the group will rush in to see the patient and find out how the patient is doing. There's minimalism in time spent with another human being. This has been both my observation and my experience, unfortunately, as a patient. And though I'm well known in the hospital that I've served for nearly 60 years, the system is so fixated that it cannot take time even for its own. And of course, the ordinary patient gets a far rawer deal. The cost is unbelievably high. And this struggle requires a change of values and a return to Verkovian values, where the patient was primary and what affected the patient has to be addressed both socially as well as medically. And this, an organization such as yours, has an enormous challenge in India. Of the little I saw of medicine there, it had our problems multiplied many times. I wish you well. I think a physician's movement has to be educating people to comprehend the power they possess in order to change it. It cannot be changed by doctors by themselves. It has to involve the community. And outreach into the community is a difficult challenge for doctors. I know it from the many organizations I've helped organize during a very long life. I learned then that doctors have enormous power if they act together, if they connect with the community, and if they have morality on their side and are factual in their presentations and are not preachy. They're not trying to promote religion. They're trying to promote a more humane society for their calling and for their patients.